Most people I see with gallbladder problems tells me the same thing. It comes and goes, so I thought it was nothing. That sentence is exactly why gallbladder disease gets missed. This is the main problem. Gallbladder pain is intermittent, so people assume it's harmless. And the clear truth, gallbladder disease does not fade, it pauses. So we would ask why people misunderstand it. The pain often comes after meals, lasts a few hours, then disappear. So people think if it were serious, it would not stop. Let me tell you what actually happens with gallstone. So gallstone temporarily block the bile, that tube duct. The pressure builds, the gallbladder spasms, the stone moves, and the pain stops. So the pain stopped, but the problem did not. And this is the missing piece most people never hear. You can have a classic gallbladder pain with the stones or without a single stone at all. So gallstone, as we said, physical obstruction seen on the ultrasound, and it's very, very common. There is another problem we call biliary dyskinesia. So without stones, the gallbladder does not contract the right way properly. So pain is identical after meals, comes and goes. Ultrasound looks normal, and the diagnosis is with what we call HIDA scan. It's a function test. So it's different mechanism, same suffering. And this is the critical logic gap patients are told. Your ultrasound is normal, so nothing is wrong. But you can have biliary dyskinesia, and function does not show up on pictures. It shows on HIDA scan, this functional test. So we have to have both ultrasound and HIDA, both of them negative, to exclude gallbladder disease. Before I move on, let me make one important clarification. Not everyone with gallstone needs surgery. Example, incidental finding of an asymptomatic gallstone, and not everyone also with biliary dyskinesia does either. Symptoms pattern and functioning decide, not one test that will make the decision for surgery or not surgery. Now let me cover the most asked question. What does gallbladder pain feel like? It's right abdominal and center. The center is part of it, often radiating to the back, the right shoulder blade, frequently with nausea. Gallstone go away on their own? No. Symptoms may pause, but stones do not disappear. Can we fix gallstone with diet and dyskinesia? Diet may reduce the attack, but the underlying problem remains. Is gallbladder pain an emergency? Not always, until it is. What happens if I do nothing? Doing nothing often leads to escalation, ER visits, infection, pancreatitis, and surgery under worse condition. Do I need surgery if I feel fine now? Usually symptomatic gallstone or biliary dyskinesia are usually an indication for surgery. You have to decide with your surgeon after weighing the risk and benefit, which always the base in every surgical treatment and decision. And remember, ignoring patterns is how options disappear. Sometimes gallbladder pain is benign, but it should never be assumed and never ignored. So this is red flag. When you have a constant pain that lasts for hours, 5-6 hours, when you have fever or chills, yellow eyes or dark urine, those three things are not to wait and see. They are for evaluating moment. Very important. You know, I rarely operate urgently on patients who come earlier. This is not about rushing into surgery. It's about recognizing a pattern and getting clarity before urgency decides for you. This is Dr. Ben Mamer. Hit follow to help build momentum to fix healthcare in America. And please tell me what part of this surprised you, because your feedback helps me sharpen the message.